COVID case numbers are continuing to rise across the country, but with long testing lines, delays in results and a lack of rapid tests available, many people are opting to stay at home and ride out the virus instead of getting a PCR test. So what does that mean for daily case numbers in states and territories? To discuss this, I'm joined by infectious disease modeller Michael Lydeamore from Monash University. Good afternoon to you.
Good afternoon.
So New South Wales cases are over 35,000 today, Victoria over 17,000. We know these cases are climbing. Are case numbers relevant now?
Well, they're still relevant in the sense that as they go up and down, I'm sure the true number of cases that are out there are going up and down at the same time. But exactly how many there are out there, I'm afraid we just really don't know anymore. Anywhere between 2 and 10 times is in the realms of possibility.
There is a huge gap between those two numbers. The Deputy Chief Medical Officer said yesterday the data isn't telling us what's really going on, that there is certainly more community cases than what we're aware of, which isn't necessarily a bad thing though, is it?
No, as long as hospitalisations stay at manageable levels, it sort of doesn't matter to an extent how many cases we have. But the difficulty we have by not knowing is that we don't know what's going to come next. And if you're trying to plan for a health service in terms of things like staffing or equipment, if you don't know where you are now, it's going to be very hard to know where you're going to be in 2 weeks' time.
So New South Wales residents in particular today have been told to prepare for several more weeks of coronavirus. The Premier saying with a sharp increase comes a sharp decline. Is that the case? Is that what we're seeing in other parts of the world?
Well, certainly in South Africa, they've had a pretty clear peak and then decline of Omicron-related COVID cases. We're not 100% sure what's driven that. It could be due to the high circulation of COVID there beforehand or things like their younger population as well. I think a few more weeks of increasing case numbers is definitely on the table. As to how the other half, if you like, of the curve will look like, I think we're just not sure how flat or sharp that's going to be at this stage.
Obviously, National Cabinet is underway at the moment. The supply of rapid antigen tests is very high on the agenda. If we look to other parts of the world, the UK is a great example. Over there, cases, those utilising rapid antigen tests are now being included in case numbers because they're utilising a QR code that is accessible on those tests. Is this a system that here in Australia we should be considering?
I certainly think we need some system to report rapid antigen tests. It's clear that they're a very good idea. They're freeing up the PCR testing system, which requires a lot of staff and a lot of expertise to run. But if we can't record them, then we can't really do much of the planning like we were talking about before. The QR code system works great over in the UK. I think at worst, we could wholesale copy it here. Obviously, it's not necessarily an overnight fix. But some sort of system for reporting these tests will be absolutely critical to our forward planning.
It will give more of an accurate picture of the infections in the community, which is what the Victorian government, state of Victoria, I should say, is calling for today as well. That, I suspect, is more helpful moving forward, having a more accurate picture of infections, of numbers.
Absolutely. If you know where you are now, it's a lot easier to work out what's going to come next. And having a way to report the rapid tests is a good step in that direction to work out exactly how many people have COVID at any one time.
And what's the danger of losing count, so to speak?
Well, if we lose count, then you can imagine if we're on the top end of those numbers we were talking about before, so up to 10 times the number of reported cases, then we're going to see a very sharp increase of hospitalisations that we may not be ready for. And with increases in hospitalisations, you need more staff to run the care for those patients. You also need equipment, PPE, all of these sorts of things. And the difference in planning from 2 times up to 10, you can imagine just how much of a difference that is in things you have to acquire ahead of time.
So the numbers as they stand at the moment, as we said, they are on the rise. What is that telling us and what is it indicating about the testing system?
Well, the PCR testing system is completely overwhelmed at this point. In New South Wales today, over 30% of people of tests processed were positive tests. That also slows down the actual testing system because they can't batch together tests like you can do when they're all turning up negative. Unfortunately, all that's really telling us is that the numbers are increasing and that there's a lot more out there. We can't, unfortunately, work out just from how many tests are positive, how many infections there are likely to be out there.
And just lastly, before I let you go, what would you like to see come out of National Cabinet today?
Well, I would like to see some sort of national system for reporting these rapid tests, as well as some way to actually get these tests into the people, to the people that need to be using them. The more tests that we can do, the more confident that people will feel, not just in terms of their own health, but also in their ability to move around the community and live a more normal pre-pandemic life. If you don't know if you've got COVID, it can be very scary to go out there and mix around and not know what's going to happen. So I'd like to see something down those lines coming out today.
Dr. Michael Lydeamore from Monash University, thank you so much for your time this afternoon. We appreciate it.